This 83-year-old female patient was referred to me for endodontic treatment of tooth number 3. You can see a large periapical lucency associated with this tooth and pretty much almost completely calcified. Not almost, completely calcified. Gold crown on the tooth. This is another angulation. Where are the canals? Where are the canals? So anyways, let me show you intraorally what we had with this tooth. This is the clinical presentation of the tooth. That's the tooth here. You can see a buccal partyless active sinus tract. That's discharge. That's purulence. All right. So we discuss options with her. I let her know I may not even be able to do the root canal. She's 83 years old and said, please try. Please try. If you can do it, then you do it. If you can't do it, then so be it. I'll pull it. But I'm 83 years old. I really don't want to go through extraction and bone graft and all that other stuff. So please do your best. And I said, okay, all right, I'll do my best. I'll try. And went through the gold crown. And of course, she, as I said, 83 years old, opening this much. Little tiny 83-year-old woman. This was a very interesting tooth. I first found the palatal canal and fully instrumented the palatal canal. Then I used geometry, and then from that I was able to locate the distobuccal and MB canals. There was no MB2. This tooth was a very interesting tooth. It was a upper first molar with C-shaped anatomy. You usually don't see a C-shaped anatomy upper molar. Usually those are associated with the lower molars, especially second molars, lower second molars. But in this case, this was a C-shaped upper first molar. I use these files. Love these files, the Easy Shaper files. You can purchase them from flexivodental.com. I have no financial affiliation with this company. It's a post-op. So take a look. C-shaped. They all join. So when I was putting the BC sealer in the MB canal, it filled the other canals as well, the palatal and the distobuccal canals. As you can see, everything went beautifully. Everything went beautifully. She was so happy that we could save this tooth for her. And I told her, I said, you know, we may have to work on number 4 also, but for now, let's just wait and see if that blister goes away. Another angulation, as you can see. All right, but worked out beautifully for this patient. So I'm gonna, I scheduled her to come back in 1 month and then 6 months, just to keep an eye on this tooth. Hopefully we don't have to do endo on number 4, but we might have to do endo on number 4 also, because as you can see, the lucency also has involved the tooth number 4. But for now, I'm very conservative. Let's wait and see on this. But as you can see here, everything went beautifully with this tooth. Another angulation. All right, so stay tuned. I'll have her come back in 1 month and 6 months. Hopefully that blister goes away in 1 month, and then if that's the case, then 6 months, and hopefully we don't have to work on tooth number 4. All right, excellent. Very interesting. C-shaped on upper first molar.